What is it?
Hey, Dr. Lindsey here. Hey, Wendy and I are going to talk to you about a guy that walked in last week, and this is something we see all too commonly. And I've got a couple other videos up that go along with the same thing, so feel free to look through those. But this is a typical guy that's had an FUE that comes in that's not real happy. And so and I'm not sure how to put the pictures up while we're talking, so I'll pause and we'll cut in the pictures. So this
we
fellow,
didn't know that he wasn't happy.
Yeah, we didn't know he wasn't happy. So this guy walks in, a nice fella. I guess he's probably 35 or so. Thick-haired Indian. Those hairs typically grow really well no matter what you do to them. He walks in and sits down in front of me, and he goes, "Well, what do you think, doctor?" And I said, "I think you're either losing your hair or you've had a bad hair transplant." And he goes, "It's the second choice." And I said, "Tell me what happened." And he said he went to a reasonably well-known FUE guy and paid for 2,000 FUEs. And he's now a little more than a year out from his surgery. And this is what he's got. And I said, "Well, you know, FUE typically is less consistent than strip, particularly in finer haired people, but you got really bushy hair. So I'd say this is a pretty typical 2,000 graft result that walks in here that's been done someplace else." And he goes, "Well, what are we going to do to fix it?" I said, "Well, you have a couple of choices. One is you can assume that all the hair that you currently have in this area is successful FUE. And if that's the case, then we probably need to do 1,000 or 1,200 grafts, maybe 1,500 grafts to just add a lot of density in the front third of your head. Or you can make the assumption that none of that hair is FUE, and that you just didn't get much growth at all, and I can't tell you that without seeing your before pictures." And so if it's the second choice and he didn't get much growth, then it's going to be like treating him with a virgin head, except he's got a bunch of scar tissue in the donor area. And sure enough, looking back in the donor region, he's got donor depletion and lots of little white scars. And some of them have hairs coming out of them, meaning they miss the roots, and some of them don't. So I really don't know. So a couple days later, he emails in pictures. And here is a picture of him before. And when you look at that and compare it to his current picture, I don't see much difference. In fact, if anything, I think he's lost a little hair right up the middle, either due to trauma or due to continuation of his male pattern baldness. Let me put these pictures up again. Here's before. Couple of views. Here's his surgical here's at the end of the surgery, and you guys feel free to count them. I'm not sure that's 2,000 grafts, but who knows what happened there, but that's simply not enough density. And pay particular attention to the hairline. If you look at the hairline there, the hairline's really nice and done, but there's no hairs behind the hairline. So, I mean, even if all of them grew, it wouldn't be enough. And then here he is now. So my best guess is that we have to treat him as if he's essentially a virgin frontal third of the hair. There'll be some scar tissue underneath, but this will grow. I mean, he's got great hair to work with. He just needs more of it. So then the real issue is, do you do just the corners where he's really missing hair, mainly on his right side, or do you do the whole thing? And my argument for doing the whole thing is clearly in the past year he's lost hair right up the middle. So hopefully he will get back to us and decide what he wants to do and how we're going to do it, and I'll update it. Don't we see this all the time?
All the time. What would you do? Would you like to do all of it?
I want to do it all and put this thing to bed, because, you know, otherwise he's going to be at somebody else's office. If we do just this, he's going to be at somebody else's office 13 months from now, saying that quack here in McLean didn't put any, you know, the hair didn't grow in the middle. So I want to hit it, and hit it hard. And I don't know that it's going to grow, but that thick Indian hair typically grows really well. So we'll keep you up to date. Anything else you want to add?
No, I called him up to tell him that our plan has changed, because we looked at his before pictures, and then instead of like 12 to 14, we would have to do like around 24, yeah. 2,500, whatever the strip would yield, because we can't he had,
He's got a buttload of scar tissue back
yeah,
there.
so told him that. So he's coming to see you and book his surgery and see what he likes to do.
So consumer beware.
Yes.
Do your research.
Ask lots of questions.
And most important, look at some cases that the doctor you're picking has done. And
Yeah.
if he's not posting cases, you got to ask him why, because it's not that hard to post cases.
Yeah, like a lot of before and after pictures. Show me what 1500 will do to me. Show me what 1500 and be aware of. Yeah.
Okay, good luck to you guys.